On February 1st, Washington forced over 1 million Americans aged 55 to 64 into 20-hour weekly work requirements, just to keep food stamps worth $6.20 per day, slashing $186 billion from SNAP through 2034 under the One Big Beautiful Bill Act. While 2/3 of workers over 50 face documented age discrimination according to AARP, that makes employment impossible. And if you're homeless without addresses for correspondence, caring for sick spouses, or living in rural areas where part-time work disappeared, when child care providers declined since 2017, the message is prove you're employable or starve. Wait, because the One Big Beautiful Bill Act created barriers while groceries cost 29% more than 2020, and Iowa food pantries report demand spiking from 100,000 to 170,000 pounds daily as 83-year-old volunteers serve 87-year-old neighbors, while New York faces paying 7 times current costs and Trump threatens withholding benefits from 21 states over immigration disputes. On February 7th, the federal court sentenced Nigerian Iboka to 8 years for a 7-year scheme that sent hundreds of thousands of personalized letters to elderly Americans, falsely claiming Spanish banks held multi-million-dollar inheritances requiring upfront taxes and fees, defrauding 400 United States victims of $6 million total, while co-conspirators across the United Kingdom, Spain, Portugal, and Nigeria operated a transnational network, and the Justice Department confirms. This was the second indicted case from one fraud ring with 8 accomplices already convicted, yet elder scams cost Americans 60 plus $3.4 billion in 2023 according to FBI and Medicare. Complete center data because tech support frauds, romance cons, and government impersonation schemes target seniors whose retirement savings make them prime marks. Why prosecute after losses instead of funding prevention? And how many inheritance letters arrive today while postal inspectors process backlogs? On February 3rd, the Senate passed 71-29 a Consolidated Appropriations Act reforming pharmacy benefit managers for Medicare Part D, prohibiting compensation tied to drug prices and granting CMS dispute authority. But the law protects only Medicare while abandoning 150 million Americans with commercial insurance to the same rebate schemes, driving prescription costs higher. Wait, because this reform carved out employer plans covering workers 50 to 64 who cannot access Medicare yet, letting PBMs like CVS-owned pharmacies and negotiate prices with conflicts the law ignores. And while Medicare must publish negotiated prices, commercial plans stay secret so your employer never knows if insurers get deals or commissions. The law skips spread pricing where PBMs charge employers more to make pharmacies and ignores DUR fees, forcing independent drugstores to repay insurers months later, closing rural pharmacies where seniors needed care most. How is protecting some while abandoning others reform? The cruelty connects because forcing hungry seniors to prove work costs more in emergency visits than food assistance saves. Fraud prosecutions recover pennies after victims lose savings. And partial PBM reforms could save billions but require confronting lobbying power Congress won't challenge. So Merrill Hancock gets charity from Walter Rogers in Ohio. Elderly Americans wire savings to Nigerian cons because Social Security doesn't cover rent, and working families pay double what Medicare patients pay for identical drugs. Don't we deserve a government that feeds people before wars, prevents fraud before prosecuting, and regulates completely, not partially? And if this matter, share it with someone who thinks these problems exist, separately, not by design, because the evidence is overwhelming.
cruelty is intentional.